I once had a patient who actually who came to me and asked me if they could put their dog on AHCC. So I said, well, why not? I mean, it's safe. You know, their dog had cancer, was going through chemotherapy, and very upset. And I own dogs, so I know exactly how they feel about that. So I said, absolutely, please do it, and please report back to me because I'd be really curious about it. So she comes back maybe a couple months later and tells me, I've been having my dog on AHCC. The tumors are much smaller, much better energy level, running around. I mean, and this dog was knocked out by the chemotherapy by her report. So I thought that was, so I thought nothing of it. I thought it was great, yet another thing that we can use AHCC for. But then they did a big trial in Europe, and the trial in Europe actually showed remarkable success with chemotherapy, dogs, AHCC, and how it improved their health and that sort of thing. And actually, the European Union has now adopted, or the veterinary part of the European Union has now adopted AHCC as part of their treatment program when they're giving dogs chemotherapy. And hopefully soon it'll have the same effect here in the United States. I think it's perfectly safe to give AHCC to children. I've written a book called Feed Your Kids Well, and I've been using it in children for many, many, many years. And basically, AHCC is just a medicinal mushroom extract, so there's really no harm in that. We know that we know the safety profile is there, so I think it's really important if you want to give your kids something to help their immune system, especially since they're always in contact with each other and spreading germs around, and there have been cases of closing schools because of this swine flu epidemic. I think that if you want to give it to your children, absolutely, by all means, go ahead. I use it in a slightly lower dose, obviously. I would use 250 to 500 milligrams. Maybe once or twice a day, depending on and it goes by body weight, so it depends on really what size they are, not really what age they are. In my opinion, AHCC is really quite safe. I mean, for instance, I've been using it for it's got over 20 years of clinical use. I've been using it in my practice for at least 15, 16 years or more now. So personally, and I've been taking it, so I know for a fact that it doesn't, or for a fact that it's safe. Secondly, Harvard did a study looking at specific safety of the product and shown that it does not have any adverse effects. Another important part of the safety of AHCC is the fact that there's research to support that it doesn't overstimulate the immune system, which is really important. That's important both for healthy people, and it's also important for people who have autoimmune diseases, because people with autoimmune diseases, that you don't want to overstimulate the immune system. AHCC actually works as an immune modulator, so it actually helps to modulate the immune system. So what needs to get more expression will get more expression. What doesn't need to will not. So it's something that can actually be taken all year long. It can be taken every day. You don't have to worry about that. So it can really be used on pretty much, I would say, almost any individual. Cancer does disproportionately affect older people. However, what people don't realize is that each and every day, each and every minute, as I'm sitting here, we're producing cancer cells in our bodies. And our immune system is going there, acting like Pac-Man, and going and just gobbling up those cells that are not dividing correctly. So if our immune system isn't functioning properly, if our immune system isn't there doing its job, that's when cancer can set in abnormal times of your life. Not that there's any normal time in life for cancer, but I think it's just with cancer being on the rise and there being so many different expressions of cancer, that I think it's really important that everybody understand that these cells are in our body every minute, are being formed. So you've got to have a healthy immune system. And in the Yale study that we did on AHCC, it actually showed that the dendritic cells, the natural killer cells, it showed that those increased. And those are the cells that actively go about and gobble up the cancer cells that form in our bodies every day. I think it's really important to just take everyday normal precautions that you would as if you were dealing with any flu. There's no reason to wear masks. There's no reason to stay out of work. There's no reason to do anything like that. I just think it's really important that we take regular necessary precautions. So hand washing. Make sure you're not putting your hands into your eyes and your mouth and things like that. Just eating correctly. I think eating correctly, getting enough sleep, exercise, all those little things that are just really everyday preventive for just about any disease, I think really plays a very key role here in helping to support our immune system, because that's really what we want to do. That's the key here, is to keep your immune system healthy. If you keep your immune system healthy, then you don't have to worry about any flu that's going around.